health crisis. While effective prevention has made Uganda one of the few countries in Africa where prevalence has decreased, in the past, little could be done for those who were already infected.
We are not the people like the other years, that today, now they have tested, I'm going to die, I'm alone. No, we are many, we are not alone.
Although sadly still not available to everyone, there is new hope for many who are suffering from AIDS in Uganda. After years of waiting, antiretroviral medications, or ARVs, have finally become more available, thanks to several well-funded international initiatives. In tribal tradition, there were hundreds of specific drum messages that inform the people of important news. When anyone heard the drums, it was their responsibility to repeat the message so that the largest number of people would be alerted. With the scaling up of antiretroviral therapies and new community-based support systems bringing hope, there are many reasons to beat the drum loudly.
I'm called Canon Gideon Biamugisha. I am an HIV positive religious leader. I work with World Vision International as the HIV AIDS advisor in the HIV AIDS Hope Initiative. I am the chairman of the African Network of religious leaders living with and personally affected by HIV AIDS. I'm also a commissioner on the Uganda AIDS Commission. There are good news about HIV AIDS. The first piece of good news is that HIV is now preventable. We know how it is transmitted. We know how it is prevented. So people living with HIV AIDS like me can join in efforts to break the transmission chain. And that is very, very important if we are to reduce the prevalence and to cut down the numbers of new infections or transmitting our virus from ourselves to our children or to our spouses. That's very, very important, that HIV is preventable. It's not inevitable that we must continue having new infections. The second piece of good news is that HIV/AIDS is now manageable. You can live long and productively for yourself, for your country, for your family with the virus. You can manage it. There is treatment available to prolong your life, to forestall opportunistic infections. Most of the opportunistic infections are actually treatable, like TB and others.
Several low-cost community-based delivery and adherence systems have emerged to address the general lack of resources and a vast need for services. One is the Reach Out program, established by the Mbuya Catholic Church on the outskirts of Kampala. Father Joseph Archetti is the parish priest.
I am proud, not because it's due to me. I am proud because I can witness to some realities which may be
Reach Out is showing how a community can come together to deal with even the most serious of public health emergencies.
Most people think that if you want to help people who are sick, you have to have buildings, cars, offices. That's what they first think of. But they can learn from Reach Out that from just within a small part, from just the church, we have opened up to help almost 1,600 clients.
Reach Out started as a volunteer program to address the community's needs. 3 times a week, the church is converted into a clinic, providing comprehensive care to those in the parish affected by HIV/AIDS. Dr. Margrethe Juncker has been instrumental in bringing medical support to Reach Out, but she believes that she and other volunteers are receiving at least as much as the clients.
I think that there's a lot of our volunteers here who, like myself, feel it as a gift that you can live your religion perhaps instead of preaching in it. And I think that's an important part, that you're given a chance to do something. And actually, I am very happy for the chance that I have to work here. And when people want to come and be part of Reach Out, I take it that we are actually giving them a wonderful chance.
And so it seems, for many, Reach Out, although dealing with the worst public health crisis in human history, is a wonderful place to work.
My name, I'm called Rosemary Mugalula. You can add on Namuli. I'm a widow. My husband passed away in 2001, in November. Before I joined Reach Out, I was working as a librarian in one of the school which is under the parish, which is St. Chisto Secondary School. I was there for a couple of 4 years. So by that time, I started falling sick, on and off, on and off, on and off. I didn't know what was happening. In December 2001, the parish priest, Father Joseph, called me and told me that there is a certain doctor who has started coming here. She will be helping people who are sick and helping people who are in the community. So can you come one day and you meet her so that you can discuss with her your problems? It was 3rd December 2001. I came. That was the day I met Dr. Margrethe.
Yes.
Here in the Reach Out, what helps very much to take away the stigmatization and so on is the fact that our volunteers were clients and volunteers together. So much so that if you come here now and you look at people, you don't even realize who is sick and who is not sick.
Next, move the right leg forward.
Especially innovative is that the recipients of assistance are becoming caregivers.
I'm Rosemary. By the time I joined Reach Out, the first thing Dr. Margrethe told me that, Rose, as I have seen you the first time, I feel you should be the first person where all the people, they should reach first and they can go everywhere. You have to be the head of the reception. Since the time I joined Reach Out, I'm the head of the reception. Oh, you have already one. I went and tested my CD4. I had 37 CD4 count. I had nothing to do. They told me to enroll me in their program. They put me in their program and I started the ARV. That was in June 2003. After 3 months, my CD4 counts raised up because by the time of 3 months, I had 158 from 37. So I gained, my kilograms increased because by the time I started ARV, I was only 46. I came to 52, 53, 54, now I'm in 65. I feel I'm happy. I'm very happy.
In Mbuya, when they talk about positive living, they are not only referring to those who carry the virus. As the project has grown, the number of tasks has also grown. One of the most important is to ensure that those who are prescribed ARV therapy correctly adhere to the drug regimen. This is critical to make sure that the virus doesn't develop drug resistance. Reach Out has created an innovative program for community ARV and TB treatment support, or CATS.
It's good that you always boil your water for drinking.
Yes, please.
The cats are clients themselves who are taking either TB drugs or who have ever taken TB drugs and ARVs. So they go to the clients' homes, they monitor them, they visit them. They see how they're taking their drugs, they count their pills in their homes, they check on how they're marking their ARV cards or TB cards, and they assess their general home for any social needs if a client has any.
So now it's around 3. So there's improvement?
Yes, please.
In fact, we could call them like adherence counselors. They're just there to make sure these people take really their drugs the way they are supposed to take them.
Concern about breeding resistance has been used by some as a justification for delaying free access to ARV drugs.
The big spectre of worry is that drugs are given out, compliance or adherence to those therapies is not maintained, and we will then have an epidemic of drug-resistant virus. And that enormous concern drives us to have compliance or adherence strategies which are sustainable.
The experience from Reach Out is important in evaluating this concern.
We are treatment supporters. We help clients take their medication well. But we tell them, because we've also had the same problems before, but we overcame them. So we tell them, we encourage them to continue taking the drugs, so after some time, they get used to the drugs.
And we have produced an adherence of 99%. It's just that people need some more extra support to do the taking of the drugs. It's not that an issue of you give them the drugs and they go with them in their homes. These are new drugs, they have a lot of reactions, and they have a lot of things attached to them. So if you give the drugs in the right way with an holistic package, I'm sure everyone is able of taking those drugs. And we have proved it.
This is not going unnoticed.
The experience of Mbuya Reach Out, for instance, is that compliance adherence is very high. And why? Because those drugs are being delivered at home by family and people affected with HIV themselves, who are passionate about their mission. And they are prepared to spend a lot of time, much longer than the medical profession can afford to or available to spend. So I would say that's a good example of how that particular program is teaching us a lot.
That is one household.
One aspect of comprehensive care that is especially welcome is food supplied by the World Food Program.
When I joined, I was only 45 kilos, but now I can weigh 70 kilos just because of the good work World Food Program is doing for us. They're giving us food. I could not afford to cater for my family of 10 people, but since World Food Program is giving us food, that now I'm able to feed my family.
Research into the role of nutrition in relationship to the delivery of antiretroviral medications and drugs for treating tuberculosis is ongoing. But experience suggests that adequate food is crucial for overcoming side effects of what are, after all, extremely strong medicines, and is also important for addressing the adherence question.
What motivates me to take my drugs promptly is just because of the food that World Food Program is giving me. Since ARV and drugs needs a lot of food, now since they are the one giving me food, they're supplying me with food, I can take my drugs promptly because there's the assurance of food.
The new availability of ARVs is changing the way people are thinking about themselves, their lives, their responsibilities.
The first thing, I just thank God of giving me that courage of being strong. And in fact, that's what I always tell my fellow clients. I always tell them that we have so many things to do. We can't think that we are going to die tomorrow. No, we have so many things to do. We have relatives, friends, we have children, we have orphans to care about.
The people whose lives have been saved by ARVs are not just sitting at home looking for handouts, but are economically productive, that their children are able to grow up in an environment of love and care, surrounded by their parents.
For patients with a new lease on life, jobs are very important, providing an income, respect, and self-confidence.
I'm a translator at the clinic. I work with the doctors and the nurses. For those who come from the north, many of them doesn't know English well, so I do help them in translating. I can translate 4 languages, Kiswahili, English, and the Luo, and a bit of Luganda.
So I worked with Friends for Life for 1 month, and they appointed me to be the head of Adult Literacy Department in July. So I'm really very happy. I feel my profession is at work.
But when you went there,
See, let us see this one. Write again and again, write many times. Units are changed, units are changed, units are changed.
And some clients are reaching for even higher ambitions.
My name is Joy Nanyunja. I'm the head of microfinance department, and namely Bread of Life. And this department gives loans to our clients and volunteers to enable them start up small businesses or even expand on those that have been existing already to make them self-sustainable.
When people get sick, they are especially burdened if they can no longer care for their children. They know that their children's future depends on education, but sometimes they can't afford to pay the school fees, forcing the children to leave school.
My daughter, she's called Diana Aqueo, and I'm really very happy for what really they are doing for me, because I could not afford to pay that daughter to school, but at least now they have taken her.
The Reach Out program at Mbuya has been fearless in acting to address all the issues facing their clients. Access to antiretrovirals are an important new component, but the basic human dignity with which the project treats clients and volunteers alike is what makes the program so special.
Our services are for free, which is important. So when they come, and it can even be a relief to get in and say, okay, I'll get my services, there's somebody who cares about me, I have my next appointment. And often what we see is people, before we even start anything, you know, the prophylaxis co-trim or their food, that they actually gain weight. And that's what I say, that people gain weight on hope and on kindness.
In all, I feel happy because I'm fully working, and now at a higher level. I'm a head of department. I just now supervise teachers, whatever they are doing. Really Reach Out has helped me in many areas. My children are on school fees, operation, I get food, I get salary on top of that.
Since now I'm very strong, I'm now working with the Reach Out. I'm a translator. I feel very happy for that job. My future plan is, if I can get now, build a house for my family.
And I also thank Reach Out of what they have given us, like hope, love, especially love, because we people living with HIV, we need many things, but above all, we need love and care. Yeah.
Reach Out is only one of many service providers in Uganda. Some, like the AIDS support organization, TASO, have played a crucial and long-term role in Uganda's HIV/AIDS response and blazed a trail for others to follow.
Well, TASO has a role even beyond Uganda because TASO was established now 18 years ago at a time when there was a lot of stigma and discrimination and denial, and where people who tested HIV positive had no hope. So in a sense, there was no motivation to go for a test. Why test if at the end of the test there's no hope? And the founder of TASO, Noreen Kaleba, whose own husband had AIDS, saw that in the West, where her husband was hospitalized in the UK, there was still a lot of care, psychosocial care and medical care given that kept people alive, that gave them hope that there was life beyond an HIV positive diagnosis.
The Mild May Center is another comprehensive initiative that has built up extensive medical facilities.
The holistic approach to care is the way to go, where you try and meet the needs of the patients in terms of their physical needs, their spiritual needs, their social needs, and their psychological and emotional needs. And where you don't have the capacity to meet any of those needs, then you use the referral system to identify people within your network to meet the needs that you cannot meet in your facility.
Great strides have been made by many individuals and the society as a whole in Uganda to control HIV/AIDS. But even more must be done.
These are early days of a massive, lifelong operation, and I don't think anybody fully appreciates both the scale of what has to be done and what it will take in terms of revamping our health systems, which in a sense creates an opportunity. Because the opportunity is, if our health systems have not been functioning well, a massive infusion of resources, primarily directed at HIV and AIDS, could be leveraged to improve health systems. But the sustainability is going to depend on the success of the current interventions and on continued global advocacy and on partnership to make sure that health systems work.
The Rakai Health Science Program is the result of 18 years of continuous research at the very epicenter of the epidemic. In cooperation with Johns Hopkins University, the program is documenting the rural population where HIV/AIDS was first identified.
I see a new chapter opening up for HIV/AIDS care and prevention as a result of introduction of antiretroviral drugs. There is a great opportunity for us to really offer help for those patients who have HIV infection. However, these new opportunities also produces great challenges. And if these challenges are not taken on seriously, we may end up writing a different story. The challenges specifically are antiretroviral drugs must be accompanied with strong prevention programs for us not to slide back into a situation whereby people think there is a treatment and therefore they can do better and therefore they relax their guard in their behavior.
The more open the society becomes, the more people you get seeking care. If the society is closed, many people will die in quiet corners of their houses without seeking any care. The suffering will be horrible. The disease will continue to spread. So those are key issues that need to be addressed.
Many more AIDS sufferers in Uganda than ever before are being treated, but tens of thousands still need access to antiretroviral drugs. Even so, the strategies and models that Uganda has employed to prevent transmission and to ensure adherence contain lessons many countries have yet to learn.
Today, if you know your status, you can plan for your future, you can plan for your family. If you have children, if you have relatives, you plan to them. I just tell my people, we are not sick. We are just, the difference we have, me and you today, who is negative, it's the virus which is in my blood, but we are the same.
We are not powerless against this epidemic. If we work together in a partnership, in solidarity, we can defeat it.